Okay, good afternoon and guten Tag. Thank you for coming to this session, and it's a great honor to me to be here and present about Korean sexual violence victims and policies for victim support. The title has a little changed. My title is Toward the Comprehensive Plan for the Childhood and Adolescent Sexual Violence Victims. Today I'll talk about the sexual violence victims policies in Korea, and the contents is I talk about backgrounds first, and then using current statistics, I will show how bad or how good the sexual violence in Korea. And then I will explain types of victim assistance facilities in Korea and what is their services. And 4, survey results on the current victim assistance policies are provided. And then finally, I finish with these policy recommendations. Let's start with these backgrounds. As a series of exceptionally heinous sexual crimes against innocent children and youth have occurred in recent years, the Korean public have asked the government for more effective control over sexual violence against children and youth. Newly introduced policies by the government include heavier sentencing, wider application of electronic anklets, chemical castration, and registry and public disclosure of identification of sexual offenders. These measures are targeted largely at the offender. On the contrary, the need to improve policies for the victim assistance get relatively less spotlight. That's why Dr. Lee and I started a project concerning sexual violence victims policies. The purpose of this study is first, to examine the current trends of sexual violence with the available official statistics. Second, to show the opinion survey results from field workers and experts about the current policies of victim assistance. And finally, I will try to suggest some policy recommendations based on these survey results. Okay. Let's see the current statistics in Korea. Table 1 shows trends of sexual violence between 1999 to 2008. As you see, the total sexual violence, adolescent sexual violence, and child sexual violence all have increased over the 20 years. You see the number of cases increased, so did the number of cases per 100,000 total population, and cases per youth population, the cases per 100,000 child population, all has increased. Table 2 shows the more recent data. And as you see, the number of instances, the total instance, and the number of rape victims under 13, and the number of rape victims under 19, all has increased. So that's why the victim assistance policy are needed. Okay. There are various types of victim assistance facilities in Korea. And as you see, there are 3 types of centers for sexual violence victims. One is one-stop center, the other is Sunflower Children's Center, and Sunflower Women and Children's Center. These centers are really immediate and the primary role in victim assistance policies. The one-stop center target the victims of rape and domestic violence and school violence and teenage prostitute. Sunflower Children's Center target at children under 19 and or mentally retarded victims of sexual violence. Sunflower Women and Children Center targets adult female and minor victims of sexual violence and of domestic violence. Plus, it deals with teenage girls and adult prostitutes too. The second, the one-stop center has 16 centers throughout the country, and we have 9 children's centers and 6 women and children's centers. The service they provide is the final column. The service they provide is medical assistance, legal assistance, and counseling. In the service they provide, they are same, but the service hour and the police presence and the location, they are somewhat different. And there are other facilities concerning to victim assistance policies, and they are sexual violence counseling center and shelter for sexual violence victims, and youth center for sexuality education, and we center. All these centers are dealing with the victim assistance function. So Dr. Lee and I conducted a survey, opinion survey, about how the practitioners or field workers think about current policies of victim assistance. We have the case of 484. Most of them are female, and most of them are college graduate. Okay. And the opinion survey in the opinion survey, we asked about the importance of current policies and priorities of current policies and what is needed to improve these victim assistance policies. And table 5 shows the priority policies they think. The first one is construction of more facilities. The experts and field workers think construction of more facilities is a really important thing. And the next is building a more efficient networking between facilities. The third is revision of law and regulations. The fourth is establishing more secure and efficient sexual violence reporting system. And then finally, support for reintegration of the victims, such as housing, vocational training, and legal assistance. These they think these policies are all important, but more urgent thing is construction of more facilities. Okay. And the second is about the effectiveness of services for minor sexual violence victims. This shows the left column shows the service all centers and facilities provide for victims. So when we ask about the effectiveness of services they provide for minor sexual violence victims, most of services are very effective, they think. But you know this red color, they think housing service and job training, employment and education service, and independent living arrangement for incest victims is relatively less effective than other services. So we need to improve some improvement of policies for these 3 aspects. And third, we also ask about need for victim shelters exclusively for minor victims. The respondents said that sexual violence victims shelters for childhood victims under 13 are necessary, and sexual violence victims shelters for youth victims from 13 to 19 are also necessary. So it means many facilities and shelters are for women, adult women and child. But they think it's not that good. because for child victims and minor victims, the service is more for their meeting for more their developmental and educational needs. So they agree with the independent facilities only for minor victims. Okay, the first is then we ask about what we should do for the childhood and adolescent sexual violence victims by family members, the incest victims. And the respondents said more facilities to separate childhood and adolescent victims from sexually abused family members. Then they really strongly agree with these more facilities are needed, and they strongly agree with the legal rights of shelters for compulsory separation, and they also strongly agree with family counseling. So the red color shows the percentage of respondents' answer for that category. Okay. And fifth, we also ask about how the necessary actions to support male minor victims. Okay, over the 60. Okay, let me check. Okay. Although the number of male minor victims is very small relative to female counterpart, 60% of respondents think we need to aware the existence of male sexual violence victims, and 20% said to foster more experts and professionals who have knowledge about effects and aftermath of male sexual victims. And almost 18% think there should be shelters for only male minor victims. Okay. How many minutes do I have?
5 to 10 minutes.
Okay, 5 minutes. Okay, good. So based on these survey results, we make some policy recommendations. First is to provide treatment and counseling for the long-term trauma of childhood and adolescent sexual violence. We know that minor victims suffer more than adult victims from long-term consequences of sexual violence, such as damaged goods syndrome and lowered self-esteem. Thus, treatment for minor victims should incorporate their unique emotional, developmental, and educational needs. Second, to provide financial support for families of childhood and adolescent sexual violence victims. In many cases, the victims come largely from low-income families. After the incidents, their parents may quit their work for taking care of the victim, and in some occasions, they may move out to escape from rumor and gossiping about this victimization. So many of them desperately need financial assistance for all this. So the government should help financially for those families, the victim families. And third, we should be aware that there are male children and adolescent victims of sexual violence and their suffering. According to a rape victim survey, male minor victims comprised of 16% out of all victims. So we should recognize there exist male children and adolescent victims. And fourth, we should secure budgets to support childhood and adolescent victims, such as medical bills. According to a news report, average medical coverage for each sexual assault victim remain almost $40. It's far less than necessary. So especially the government should cover more of medical expenses of the victims. And fifth, we should establish more shelters exclusively for childhood and adolescent victims. Okay. Yeah, there are only 2 shelters in Korea exclusively designed for minor victims. But the experts and frontline workers ask for more shelters for minor victims. And finally, we should set a more structured partnership and networking between shelters and agencies. It seems that in Korea, immediate and primary services for minor sexual victims are managed quite well. But after that stage, shelter and centers are loosely organized. So more efficient referring system must be established, and cooperation between shelters and agencies must be developed in a more constructive way. Yes, this is what I have for today. Yeah, and if you have any comments or questions or advice, then feel free to raise your hand and ask something and say something about it.
Thank you.
Yeah, thank you. And in addition, there are many Korean scholars here in the room, and they are ready to answer about your questions. So feel free to ask something to us. Yeah. Oh, okay.
Yeah, thank you very much for your presentation. Right at the beginning, you showed us, I think, the official crime statistics from Korea showing us a heavy increase in sexual violence. What's the reason for that increase? Is it a real increase, or probably the society is more sensibilized for that kind of problem, or is the society really getting more violence? Or is there more sexual violence in Korea?
Yeah, it's really hard to answer. There must be various factors to contribute to this increase. But I think maybe it's because more people willingly report their victimization to the agencies. That's the key factor. And second, the more obscene, many people can get access to the more obscene materials through the internet. So that's the second factor, I think. And maybe the liberalization of sexuality also can explain the part of this increase. Is that enough? Enough answer to you? Yeah.
So you think it's more change in
the reporting system can explain this increase, and the changes in the individual mind also contribute to this increase, I think.
Well, do you have like a victimization survey, or do you only
yes,
have?
We have. Yeah, KIC conducted victimization survey every 2 years, I think.
A representative?
Yes, yes.
So you should have other data than the police data.
Sure, yeah, yes.
And that's also going up? The sexual violence or violence in general, or?
You can help me for this question? So in the victimization survey, it doesn't appear that increase. You mean? Then
It
that
doesn't-
means the reporting system. Yeah, the
Okay,
more
so-
people willingly report their victimization.
So maybe the society is more sensible
Yes,
and reports more to the
yeah,
police.
yes,
maybe.
yes.
Okay.
I think so.
I understand that there are quite a number of shelters for child victims already in the country, and you
Jan, could you take?
and you recommend that there should be set up even more shelters. I was wondering whether there isn't a risk that you institutionalize too many child victims for too long. Wouldn't it be more important to have a better system of foster parents for small child victims? Foster parents.
Yes.
You
Yeah.
Is that available in your
Yes.
So how long do they stay
But
in
you
the
know,
shelter
it.
then?
Okay. As you see in the number of centers throughout the country, there's too small to cover entire country. So many people say we need more facilities. So
But how long do they stay in these? How long? 1 year, 5
at
years,
least
1 week?
at least 6 months to 1 year. 1.5 years.
Okay.
Yeah, at most.
And then they come back to their families, or where do they go after?
After that, they are
To the-
going to.
원가족으로 돌아가.
Yes, their family of origin, or
18세까지 있을 수 있어요.
or they can go to a foster family too. Yes.
So it's somehow similar. I hope you went through the exhibition there, because we have a lot of stands from German initiatives for sexual abused children that display their work and show how they, how their approaches work.
Yeah. Okay.
So you
I will
should
check it.
definitely- yes.
Yeah. Okay. I will check it.
Okay, any more questions? Then thanks again, and we have we continue at 2 again. Thank you.
Okay. Thank you very much.